Imagine your body has been sending you warning signals for weeks, but you ignore them, thinking it's just fatigue or stress, and then one day, the unthinkable happens. Today, I'm going to reveal 12 signs your heart uses to scream for help, signals that even some doctors can sometimes miss. And beware, sign number 8 could completely change how you perceive certain sensations. Hi, everyone. If it's your first time here, I'm Emmanuel, and on this channel, we demystify the secrets of our health together. Today, we might save lives, perhaps even yours. But before we start, promise me one thing. Stay until the end. Because the last sign I'm going to talk about is so sneaky that many people suffering from it don't even realize they're in danger. Before we dive in, don't forget to like, subscribe, and if you want to support the channel, give a hype. Let's begin. Sign number 1, pain that travels. Let's start with the trickiest one. You think a heart attack always comes with a sharp chest pain, like in the movies? Think again. The first sign is this strange pain that doesn't even seem to come from your heart. It starts in your left arm, travels up to your shoulder, then continues to your jaw. Or, watch out, it can show up only in your back, right between the shoulder blades. Cardiologists call this referred pain. Your distressed heart sends electrical signals that use the same nerve pathways as other parts of the body. It's like your nervous system is playing a game of telephone with your life. Tell me in the comments, have you ever felt unexplained pain in your left arm lasting more than a few minutes? I read your comments. Sign number 2, mysterious shortness of breath. The second sign may surprise you. You climb a flight of stairs and suddenly you're out of breath as if you just ran a marathon. It's normal. I don't exercise enough, you tell yourself. But here's what's really happening. Your heart is starting to weaken and can no longer pump oxygen-rich blood effectively to your muscles. Your body panics and makes you breathe harder to compensate. Listen closely. Shortness of breath, especially if it appears suddenly or for no reason, is often the first alarm cry from a heart in distress. Never underestimate it. Here's a simple test you can do right now. If climbing a flight of stairs leaves you breathless when it didn't 6 months ago, that's a red warning signal. Sign number 3, fatigue that won't go away. The third sign is one almost everyone ignores. That crushing fatigue that hits you like a ton of bricks. Not normal tiredness after a long day. No, this fatigue literally pins you to your bed. When your heart starts failing, it can't provide enough energy to your body. It's like a car running on a coughing engine. It still moves, but it consumes 3 times the fuel to go half the distance. Women experience this symptom in 70% of heart attacks according to several medical sources, compared to only 40% in men. Ladies, if you're watching this point concerns you particularly. Share this video with all the important women in your life. It could save their lives. Sign number 4, misleading nausea. The fourth sign might blow your mind. You wake up with terrible nausea. You think it's something you ate, or maybe a lingering virus. But in reality, your suffering heart activates your vagus nerve, a superhighway connecting your brain to your abdomen. Result, your stomach rebels while the problem is actually your heart. ER doctors regularly see patients who arrive thinking they have the flu and leave diagnosed with a heart attack. It's so common it's called the Sunday morning heart attack, when people think they just had a bad meal the night before. If your nausea comes with excessive sweating and a feeling of pressure, don't waste a second. Head straight to the ER. Sign number 5, revealing cold sweats. The fifth sign will give you chills. Cold sweats that soak you for no apparent reason. Not normal sweat from effort or heat. No, these sweats are different, icy and terrifying. When your heart is in distress, your sympathetic nervous system goes into overdrive. It's your fight or flight mode activating, as if your body unconsciously knows it's in mortal danger. These sweats often come with a sense of impending doom doctors call anger anomie, literally anguish of the soul. Your body knows something serious is happening. If you feel this while watching this video, stop immediately and call emergency services. I'm not joking. Sign number 6, chaotic palpitations. Sixth sign, your heart starts pounding like a wild drum. Palpitations that wake you up at night, leaving you breathless. Imagine an orchestra where the conductor loses control. That's exactly what happens. The electrical system of your heart starts to malfunction. Here's the catch. Everyone experiences palpitations sometimes. The difference? Dangerous heart palpitations are irregular, last more than a few minutes, and are often accompanied by dizziness. Here's a test cardiologists use. Take your pulse during these palpitations. If it's completely chaotic, sometimes fast, sometimes slow, with pauses, that's a major warning sign. Sign number 7, strange jaw pain. The 7th sign might surprise you again. This jaw pain you attribute to stress or grinding your teeth at night. Here's the secret. The nerves that transmit heart pain run through the same pathways as those in your lower jaw. Your brain can't tell the difference. And ladies, pay attention. In women, jaw pain is often the only symptom of a heart attack. While men have classic chest pain, you may only feel jaw pain. 42 to 43% of women who have had a heart attack never experience chest pain. They had jaw, neck, or shoulder pain. That's why women often arrive later at the ER and have worse outcomes. If you're a woman and have unexplained jaw pain for several days, don't ignore it. Sign number 8, dizziness that scares you. And here's the famous 8th sign I mentioned earlier. Sudden dizziness that makes you stagger, as if the world is spinning around you. When your heart stops pumping properly, your brain receives less oxygen. Result, you feel drunk without having had a drop of alcohol. But here's the scariest part. This dizziness often happens right before a major heart attack. It's like your body giving one last warning before collapse. Emergency services regularly see people arriving saying, "I just feel dizzy," who suffer a cardiac arrest 20 minutes later. If your dizziness comes with any of the other symptoms I mentioned, don't take chances. Call for help. Sign number 9, sneaky swelling. 9th sign, and this one is sneaky because it progresses slowly. Your feet, ankles, and legs start to swell. When your heart weakens, it can no longer pump blood efficiently back up to your upper body. Fluid accumulates in your lower limbs due to gravity. Here's a simple test. Press your finger firmly on your ankle for 10 seconds, then release. If the indentation stays visible for more than a few seconds, it's called edema. Warning, not all edema is cardiac. But if this swelling comes with shortness of breath or unexplained fatigue, your heart may be sounding the alarm. Weigh yourself regularly. A sudden weight gain of more than 2 kilograms in a few days can signal water retention linked to a heart problem. Sign number 10, persistent cough. 10th sign, and this one will surprise you. A dry, persistent cough, unlike any cold you've had. When your left heart can't pump properly, fluid builds up in your lungs. Your body tries to get rid of it by coughing constantly. It worsens when lying down and improves when sitting up. That's because the horizontal position worsens fluid accumulation in your lungs. If your cough produces frothy or slightly pink sputum, that's an absolute red alert. It could mean fluid mixed with a little blood is building up in your lungs. This heart cough requires immediate medical attention. It can be the precursor to acute pulmonary edema, a life-threatening emergency. Sign number 11, revealing sleep troubles. 11th sign, and I bet you didn't see this coming. Sleepless nights where you can't lie down without struggling to breathe, forcing you to sit up. This is called orthopnea. When you lie down, your weakened heart can no longer manage the extra venous return. Result, you literally suffocate in bed. You start sleeping with more and more pillows or even in a chair. People around you notice louder snoring or sudden awakenings. At night, your parasympathetic nervous system takes over. If your heart is already fragile, this transition can trigger arrhythmias or acute heart failure episodes. If you wake up multiple times a night to catch your breath, don't blame age or stress. See a doctor quickly. Sign number 12, silent chest pressure. And here's the 12th and final sign, the sneakiest of all. That weird sensation in your chest you can't describe. It's not exactly pain. It's more like someone is sitting on your chest or wearing a too tight vest. Some patients describe it as a burning sensation or dull pressure. This is called silent angina. Your heart muscle isn't getting enough oxygen, but instead of screaming in pain, it whispers its distress. This sensation often appears during exertion, climbing stairs, carrying groceries, even rushing to catch a bus, and it disappears at rest, giving you false reassurance. It's the ultimate trap. Because it doesn't really hurt, you ignore it. but it's often the last warning before a massive heart attack. If you feel this pressure, even mild or fleeting, don't gamble with your life. See a doctor within 48 hours at most. There you have it. You now know the 12 warning signs your heart uses to tell you it's in distress. Every year, thousands of people ignore these signals and pay with their lives, but now you know. You hold the keys to recognizing your heart's distress signals. Don't hesitate to share widely. If you experience even one of these symptoms persistently, don't play amateur doctor online. Consult a professional. Your life is worth more than pride or fear of embarrassment. And now, I need you. This video can literally save lives. Share it with your loved ones, parents, friends. Tell me in the comments, which sign surprised you the most? Have you ever felt any of these symptoms? Like this video if it helped you, subscribe for more life-changing content, and above all, take care of your heart. You only have one, and it's counting on you to listen. See you in the next video as we continue this journey toward better health together. Take care.